This is Dr. Greg Hickman from the Andrews Institute. Today we're going to do some brachial plexus blocks, and we're going to start with a supraclavicular block. This young lady is having some elbow surgery and ulnar nerve release and a carpal tunnel release, and so we're going to do a supraclavicular block. Mainly we're going to want to get the corner pocket, the lower part of the brachial plexus, the lower cord, which will have the ulnar nerve, and the lower trunk, and we'll start there and then work our way up. We're going to use the Clarius ultrasound probe, which is wireless, and we'll use my iPad here as our what we'll be seeing the nerves on the ultrasound image with. And we'll get started here. All right, we're going to start with the probe just above the clavicle, kind of parallel to the clavicle and aiming straight down towards the toes. I've got her in a little bit of a head up position here, so you can see the subclavian artery beating, and right below it you see a nice first rib, and below the first rib's the white line, and then below it's dark because bone impedes ultrasound penetration, so it's going to be dark under bone. Now what we're going to do is take the probe and just rotate it a little bit posterior so you can see the nerves there. Now you can see the nerves sitting right on the first rib. And you see the lower trunk where we're going to get right under. And I'm going to increase the gain. It's really easy. Just slide a little bit to the right on the screen of the iPad. So we're going to put a little numbness shot in here. 1, 2, 3. There we go. And we're going to use a stimulating needle, so that if we get too close to the nerves, we'll get a twitch. Come in posteriorly here, getting a little twitch there, so we'll back up. Okay, here we come. So you can see the needle, you can see the rib. We know it's safe here. We can advance, hitting the rib actually there. So I'm going to come back and try to get a little further over close to the artery. I want to get as close to the artery as I can and lift up this plexus. All right. Rocky, give us 5 cc's right there and see if that'll lift up our nerves.
Aspiration. 1.
Beautiful.
2.
Just like that.
3. 4. And 5.
Okay, so that looks really good. Now, I'm going to come up a little higher. Try to separate the other trunks. Coming in more up here. We've got our corner pocket good. Okay, we're getting a twitch there. Kind of hard here. Sometimes you can peel off the upper trunk really easy. This one's not going to be so easy. Getting some twitches there. Give us a 5 right there, Rocky, and let's see what we can open up here.
1, 2.
There you go.
3.
Okay.
4. And 5.
All right. So we open up a little bit. We're going to come back and come in up here. See if we can get in a little further, closer to the artery. Nope. Well, actually, I might do this. Try to peel off the upper trunk a little bit. All right, Rocky, give us 5 right here. We're trying to peel off the upper trunk.
1, 2. 3.
Thanks.
4.
There we go.
And 5. 15.
Actually, keep going right there.
Aspiration. 1.
There we go.
2. 3. 4. And 5.
Actually, I think we got between the middle and the lower trunks there. Now we'll try to get up here and get this upper trunk a little bit. Sometimes if the upper trunk is open, you can get right under it pretty easily. If it's really packed in tight like this, sometimes I'll just scan up the neck and I can see it a little better here, and we'll come in at approach like this and try to get the upper trunk here. Really need the middle and lower trunk, so it's not that big a deal on this case, but actually I'll just come over the top here. Give me 5 here. And we'll get the upper trunk real easy here.
2, 3.
There we go.
Five in there.
All right, now we got 5 left, so I'm going to go back down and finish off down in the corner pocket. Get my needle here where I can see it. There's our needle. We're going to go right down underneath the nerves, between the nerves and the rib. Get over close to the artery and pulling the nerve, so I'm going to go a little bit lower. There we go. Now, okay. Let's give our last 5 right here, Rocky. This will be a total of 30 cc's.
Respiration.
1/4% bupivacaine. Yep, right there. Beautiful. We'll pull back. Pull back. Looking good. Beautiful. And that concludes our supraclavicular block. Again, a great case for a regional anesthetic. Great case for a wireless ultrasound probe. The Clarius, really nice images that we can use. So that'll finish up this supraclavicular block. Thank you.